Let's walk through a practice question together. A 7-year-old child presents to the clinic for an annual well visit. The registered nurse knows that this client is in which stage of Erickson's stages of psychosocial development? 1. Trust versus mistrust. 2. Industry versus inferiority. 3. Intimacy versus isolation. Or 4. Integrity versus despair. I know these stages can be a little bit tricky, but sometimes if you read the words within the stage, they kind of give you a hint as to what is going on in that stage. So let's work through them. Number 1, trust versus mistrust. So the first thing we need to ask ourselves, does this occur at age 7? No, this occurs during that first year of life. So is the infant receiving their necessities, clothing, are they getting food, things like that? Or are those needs not being met? Because if they're not, mistrust may develop. Number 2, industry versus inferiority. Is this appropriate for a 7-year-old child? Yes, it is. This involves the development of self-esteem during those elementary years. So this is appropriate for a 7-year-old child. Now, moving on to our next one, intimacy versus isolation. So this stage actually occurs in early adulthood, usually around the age of 20 to 40, and it's about forming those close relationships. And if people are not forming close relationships, they may start to feel isolated. Okay, so we can rule that one out. And then looking at our last one, integrity versus despair. Do y'all remember when that occurs? Yes, this is going to be in the later years of life, so late adulthood. And this really involves reflecting back on life and wondering, was my life meaningful? Do I feel fulfilled? Once again, this is not going to be relevant for a 7-year-old child. So if you chose number 2, industry versus inferiority, you would be correct. Awesome job.
The nurse is observing staff members caring for assigned clients. The nurse should intervene if a staff member is observed doing what? So we are looking for an action by a staff member that is problematic, something we don't want to do. Okay, so option 1 says connecting a medication syringe to a client's arterial line tubing. This is going to be our correct answer. We should never, ever, ever connect a medication syringe to an A-line. So A-lines, arterial lines, or A-lines are used to monitor blood pressure continuously, second by second. They are inserted into an artery. Usually the radial artery is kind of the preferred site. And we can use them for blood sampling, for arterial blood gases and whatnot, but we never want to give medications through it. Giving meds through an A-line can cause some serious problems. It can cause injury to the artery. It can cause gangrene, arterial spasm, all kinds of problems. So we just never want to do that. These meds should go through veins only. Never arteries, okay? But let's look at option 2. Option 2 says administering crushed oral medication via a client's nasogastric tube. This is okay to do. We want to make sure the medication is able to be crushed. Some meds we can't crush, so we'd want to talk to the pharmacy about that. But we want to make sure we crush them finely, dissolve them in water, just make sure we flush that tube really well so nothing gets clogged. But it is fine to do. Option 3 says applying a new medication patch at a different site after removing the client's old medication patch. This is an incorrect answer because it's good practice. We definitely want to rotate our sites if possible for medication patches, and we always want to remove the old one first. That way we're not double dosing the client. Option 4 says administering nebulized medication via a T-piece to a client who is receiving mechanical ventilation. This is an incorrect answer because it's something we would do. A T-piece is an attachment that goes kind of on the end of the ventilator. It's a nebulizer essentially, but since these clients have an ET tube, we can't, do it traditionally. So the T-piece is just the piece of equipment we use to give the neb. But that's totally safe to do and really great for our clients on the ventilator. So we'll see you tomorrow for another question.